Welcome everyone. We're going to show you how to use the HipTrac. At this point, Jessica already has the binding secured to her leg at the ankle and above the knee. In this case, she has a smaller sock on, and that's okay. A lot of people don't mind having that binding right on their skin, while others might find that to be sensitive and they'll want to wear a sock. A lot of people, smaller people too, will have a couple of socks on to make it a little bit bigger. Sometimes it's easier to secure the ankle binding when it's a little bit bigger in that area. We'll want to make sure she has her hip pad, her hand pump, her pull straps, and here's the HipTrac. We also have an extra towel that will show you what to do with that in a little bit. You want to make sure that the air is depressed all the way out of the cylinder so that this track, the metal holes, are down as far as they can be. Before getting into the HipTrac, she'll select, does she want to do it at 30 degrees, 20 degrees, 10 degrees, or a lot of people will make it go all the way down to 0 degrees, but make sure you put a towel or a shoe or something in there so that the air hose doesn't get crimped. In this situation, we'll do it at 20 degrees. Okay, so you make that secure. What she'll do is she'll first put the hip pad between her and the HipTrac. She'll put her sit bone on the involved leg all the way up against that pad. She'll make sure she has a pillow here. You'll want a timer or a cell phone so you can keep good track of how long you're holding it in your overall session. She'll grab her pull straps and she's going to pull the HipTrac. She'll set her leg here and she'll pull the HipTrac into her as far as she can while reaching the hook right here into the highest hold that she can secure into. That's fine right there, it doesn't have to be perfect. And then she'll let her leg just relax out, okay? She'll let go of the pull straps. Now in this case, a lot of people will do it straight up and down like this, while other people will want to do it slightly out, so it looks like their leg abducted or spread out a little bit. So she'll turn her body a little bit. Her sit bone is still right up against that pad. This leg will come a little bit right there. So now it looks like that her body's this way and her leg spread out a little bit or abducted slightly, okay? Now she'll grab the hand pump and start pumping. There are a lot of different protocols that people will use. If you're working with a healthcare provider, always follow their prescribed protocol. If you're not working with a provider, you'll find a lot of different protocols depending on what you're treating and what you're using the HipTrac for. She'll pump it up to that desired intensity. She'll hold it for the amount of time. Sometimes it'll be 1 minute, sometimes it'll be 5 minutes. And then after she holds that, she'll let the air back down by hitting the button. There's specific videos on the hand pump and the binding itself that you can watch later. She'll repeat that again. And she'll follow this protocol of pumping up, holding for a certain amount of time, releasing down. And when you release down, I would only release halfway down, so then there's less pumping to get it back up. Let's say that this was her last hold. She'll release the air all the way out. So we'll pretend that she already did about 20 minutes of hip traction. So once she knows the air's all the way out, she'll put the pump to the side. She'll take the hip pad out from behind her. Now she'll grab her pull straps again, and in this case, she's gonna bend her knee while pulling it into. It's like a little bit of a hamstring curl, but nothing really intense. And then once she has that pulled into her and keeps the HipTrac there, she'll simply straighten her leg and just sort of scoop right out and just set her leg right next to it. You wanna stay there for a minute or two to really just relax and let the muscles relax for a little bit. And then at that point, she'll be able to tuck and roll and get out of the HipTrac. Thank you very much.